Do you sometimes feel a strange lump under the skin, or notice that a mole changes shape? You might be wondering if these skin signs could mean something more. Carney Complex is a rare inherited condition that causes many different growths, like tiny skin spots, small tumors on the heart, or nodules on the glands that make hormones. Most people first hear about it because of a skin change, but the real issue can be hidden inside the body. Think of it as a family recipe that tells cells to grow when they should not, leading to the variety of signs you might see. What makes Carney Complex happen? In most cases, a gene called PRKAR1A is passed down from a parent. Imagine a set of instructions for a car engine. If one line is missing, the engine runs too fast. The faulty gene makes a protein that normally slows down cell growth, so without it, cells can overgrow. About 70% of cases are inherited, while the rest appear spontaneously due to new mutations. Family history is a big clue. If a relative had unusual skin spots or heart tumors, the risk may be higher. Which clues should you look for? Common signs include small dark skin spots called lentigens, often on the face, lips, or inner cheeks. Benign heart tumors called myxomas. They can cause chest pain, trouble breathing, or fainting if they block blood flow. Hormone-producing gland tumors like on the adrenal or pituitary glands that may cause weight changes, high blood pressure, or early puberty. Other growth, such as cysts on the ovaries or testicles. Ask yourself, do I have a new mole that looks different, or have I felt an unusual heartbeat? Those answers can guide you to see a doctor. How do doctors find out if you have Carney Complex? First, they will ask about family history and examine the skin and heart. Imaging tests, such as an echocardiogram ultrasound of the heart, can spot myxomas, while MRI or CT scans look for tumors in other organs. Genetic testing for the PRKAR1, a mutation, confirms the diagnosis. Treatment depends on the organ involved. Heart tumors are usually removed surgically. Hormone-producing tumors may need medication or surgery, and skin spots are monitored but often harmless. Think of treatment like a tailored toolbox. Each problem gets its own fix. Can you prevent Carney Complex? Because the condition is genetic, there is no way to stop the gene from being passed on. However, early detection is key. If you know a family member has the syndrome, you can get genetic counseling and testing before symptoms appear. Regular checkups, especially heart ultrasounds, help catch tumors early when they are easiest to treat. In other words, awareness and monitoring are your best defense. Scientists are exploring drugs that target the overactive cellular pathway caused by the PRKAR1, a mutation. Early trials with protein kinase inhibitors show promise in shrinking certain tumors without surgery. Additionally, advanced genetic editing tools like CRISPR are being studied in lab models to correct the faulty gene. While these therapies are still experimental, they bring hope that one day we might control the disease at its source rather than just treating each symptom.